All right, let's review a bit. What are vaccines? Or what's a vaccination? Remember, it's the deliberate introduction of what? A pathogen's antigen. We're not going to put the pathogen into your bloodstream, are we? Okay, so it is a deliberate introduction of an antigen from a particular pathogen into the body to do what? Trigger the adaptive immune system's memory so that you will be, quote unquote, immune to that disease. All right, then we said that for number 10, are vaccinations effective? Yes, they're effective in both theory and practice. Okay, what's the theory behind a vaccination? Introduce the antigen without the disease, without the entire pathogen being present, trigger the immune system, trigger the macrophage to present that antigen to the T helper cell. Then the T helper cell will initiate an immune response to it. In particular, we want the T helper cell to turn on B cells and produce antibodies. But more important than that, what's the second function of the B cell? It divides and becomes a what kind of cell? Memory. So we want the B cells to be activated so that the next time that part of the pathogen or the entire pathogen is introduced to the body, you already have antibodies against it. And most likely you won't even experience any symptoms. We also said that vaccinations are effective in practice. I've got a few statistics. We mentioned some childhood diseases have basically been eradicated in the United States. Polio, okay? Before vaccinations, polio on average paralyzed 1,000 children a day in America alone just over 60 years ago. Smallpox caused 2 million deaths per year in the United States prior to smallpox vaccinations. Whooping cough, okay? Diphtheria, and so forth. All of these viral infections no longer cause problems in the United States, okay? How many of you have ever had a measles, mumps, rubella? You should have all had measles, mumps, rubella, okay? Measles was the leading cause of deafness in the United States prior to that vaccination. So you've all benefited from vaccines. Don't jump on the, what do we call it, the alternative medicine bandwagon that vaccinations are harmful. They are not. Okay, let's talk today now about AIDS. AIDS is a topic that comes and goes in the news. It is a leading cause of death, particularly in sub-Saharan Africa. It is also a big problem in the United States as far as certain communities, so-called communities, but not communities in the good sense of communities. We're talking about being a problem in the so-called homosexual, I'm not going to use the word gay, community because it is a sexually transmitted disease. So the first thing I want to do is, we all have heard of AIDS. What does AIDS stand for? It is an acronym. It stands for acquired, that of course would be the A, acquired. So it is something that you catch. It is a viral infection. Then the I stands for immuno. It's called that because it attacks your immune system. So it's acquired immunodeficiency syndrome. Immunodeficiency is hyphenated. Acquired, that means it is an infection. As a matter of fact, it is a sexually transmitted disease. Immuno, because it directly attacks the immune system. Deficiency, what it does is it depletes your T helper cell population. So that means your body cannot turn on your adaptive immune system to a particular antigen. Okay, so remember we said that a virus is a subcellular parasite that attacks a specific target cell. Well, the target cell of the AIDS virus is the CD4 T helper cell. A lot of times it's called T4, CD4. That's the name, it's got a little plus behind it, that's the name of the protein marker that's on that cell that identifies it as a T helper cell. And this T helper cell is the target cell of the HIV virus. So it is acquired, it's immuno, it causes a deficiency syndrome. Syndrome. Medically speaking, a syndrome is a set of disease conditions. Not a single disease, not a single disorder. It is an entire set of disease conditions. It's not a single disorder or a single disease. Okay, so AIDS is not one disease. AIDS is actually a series of related diseases and disorders that are caused by infection with the virus. The virus, of course, is abbreviated HIV, Human Immunodeficiency Virus, HIV, because it is specific to humans, and it's immunodeficiency, and it's a virus, HIV. And what happens with AIDS in general is they get people that are HIV positive, have acquired the virus, mostly through sexually transmitted disease, but HIV is a blood-borne pathogen, which means it can be spread by blood-to-blood contact. So there are accidental ways to get HIV in a contaminated needle stick, but those are not the main ways that people get HIV. HIV in the United States, I'm referring to, HIV in the United States is a sexually transmitted disease. It is also spread by so-called dirty needle use among drug users that are sharing needles. Those are the two main ways that people are infected with HIV in the United States. Now, HIV can be passed from mother to infant and so forth, but most of the time we're not dealing with that. We're dealing with either homosexual behavior or we're dealing with illegal drug use, okay? And we're not just talking about one-time drug use. We're talking about drug use to the extreme. So AIDS is not a disease that you're going to be worrying about catching personally, all right? And what AIDS does is it causes the person to succumb to what are called opportunistic infections. Opportunistic infections. These are infections that people that have a normal functioning immune system do not get. In fact, this is how AIDS was identified in the early 80s. Literally because we had homosexual men getting these bizarre cancers and other problems that just were unheard of, that people that have an immune system just don't get. So they investigated it over the course of several years, identified the virus, and named the disorder. Okay, so there were these odd infections and rare cancers. Okay, a lot of it centered around the city of San Francisco. Okay, so this is nothing that's remotely innocent, let's put it that way. All right, so let's first of all now talk about the virus itself. The virus itself that causes AIDS, as I mentioned, is commonly referred to as HIV, Human Immunodeficiency Virus. The virus is what is called a retrovirus. Retrovirus. Retro, what does that prefix have to do with? It has to do with going back, doesn't it? Okay, that's because the HIV virus is an RNA virus. Remember the two parts of a virus, the nucleic acid core and the protein capsid. The AIDS virus does not carry DNA, but instead it carries RNA. So the normal genetic process, instead of going DNA, transcribing to RNA, it has an extra step. It's kind of backwards. It goes RNA to DNA, back to RNA. So what are the implications of having that extra replicative step? Anybody have an idea? Yes? No. It has an extra step, so it has an extra opportunity to mutate and cross over and have more genetic variety. What's the implication of that? Yes?
It's way harder to target control, or it's more dangerous than...
All of those things. We're not going to be able to come up with a vaccination for it because it changes. Okay, it literally mutates. It doesn't even have to be a mutation. It has extra time to cross over characteristics and change because it's a retrovirus. And retroviruses are especially dangerous in that way. That's the other thing with the HPV vaccination. It gives this false security. I'm vaccinated, so I don't have to worry about it. That's not true because vaccines are very specific to certain strains of the virus. Have you ever heard that phrase? This strain of this virus or that strain, even the flu shot. The flu shots are for this strain or that strain. Does it cover you for all strains of flu viruses? No, they'll target it towards the main strains. So that's another thing with HIV. It keeps changing. There's so many different strains of the virus, we're not going to get a vaccination for it. So it is a retrovirus, meaning it is genetic material. Its nucleic acid core is RNA rather than DNA. So this causes an ability for it to mutate its genome, even in the same patient. So this makes this a very difficult virus to work with. Structurally, the virus is spherical. It's encased in an extra lipid membrane. So that means not only does it have your nucleic core of 2 strands of RNA, it has a bullet-shaped protein capsid, and then it has a lipid membrane that gives it its spherical shape. Then the virus, as I mentioned before, specifically targets the CD4 T helper cell. That is the cell name. It is the CD4 T helper cell. So what it does is HIV will bind to the surface of this T helper cell, and it will inject its RNA into that cell, which destroys the cell. The other problem with HIV is sometimes the virus can be harbored in a macrophage. So the macrophage isn't able to properly present it. All it does is harbor the virus, which is dangerous because the macrophage is able to move all over the place. And if the macrophage is full of virus particles, it's not going to be an effective immune cell, and it's going to facilitate the spread of the virus. So not only are we directly attacking the CD4 T helper cell, we're also inhibiting the macrophage. And remember, the macrophage is the most important immunological white blood cell. So AIDS is a very targeted, let me even say the word well-designed virus. It will destroy the immune system. Right, so that is the HIV virus itself. Now, the process of an HIV infection. What occurs during an infection? There's all kinds of different terms. You have HIV positive, then that progresses all the way to what's known as full-blown AIDS. Not everyone that is HIV positive has progressed to the AIDS stage. So what is the process that occurs in an HIV infection? First is called the primary phase. The first part of an HIV infection is called the primary phase. This is the initial infection. The primary phase, or the initial infection. This involves a large number of the T helper cells being actively targeted, and then the TD4 cell is replicating large numbers of viruses or large numbers of virus particles into the bloodstream. So in the primary phase, this is the first step. This is the initial infection. You have large numbers of CD4 T helper cells being targeted. These cells then begin replicating the virus particles and then releasing very high numbers of virus particles into the person's bloodstream and accumulating in their lymph nodes. During this phase, the person is highly contagious, but often without symptoms. They're highly infectious or contagious and often without any symptoms. That's phase 1. That's the initial infection. That's where you're getting your T helper cells are being destroyed. They're actually producing large numbers of virus particles into the person's blood. Dangerous situation because the person is highly infectious or contagious and maybe will not even have any symptoms. Phase 2 is the next 2 to 4 weeks. So we have the primary phase, then we have phase 2 in the next 2 to 4 weeks. Person will get flu-like symptoms during which their immune system is attempting to control and destroy the viruses. So the second phase is when the immune system is mounting its attack. So the person has flu-like symptoms, fever, headache, enlarged lymph nodes, and a general state of malaise. That just means the person feels tired and weak, lethargic. So they have flu-like symptoms. And we're not referring to stomach flu, we're referring to influenza flu-like symptoms. High fever, headache, enlarged lymph nodes, malaise, general feeling of tiredness and weakness. That's malaise. During this time, the virus escapes destruction by the immune system for 2 reasons. It's mutating and it's hiding in the T4 helper, the CD4 helper cells and in the macrophages. So phase 2 is the body's attempt to destroy the virus. The immune system is mounting an attack, and that's why symptoms, especially the fever, the lymph nodes are enlarged and swollen, headache, and so forth. Then phase 3 is called the latent phase. So the third step in the progression of an HIV positive person is the latent phase. We have initial phase, then the second phase where the immune system is trying to destroy it, and then the third phase is called the latent phase. Here's what happens. The symptoms disappear. Flu-like symptoms disappear from the second phase, but the virus, the HIV virus, is harbored in lymph tissues and in the T cells and in the macrophage. The symptoms disappear, but the virus is still there. It's harbored in lymph tissues. It's harbored in the T cells, the T helpers, and in the macrophage. So the person is positive. They carry the virus, but they're not sick. Their symptoms disappear or at least subside. However, this can be accompanied by weakness, weight loss, etc. But they're not experiencing any real symptoms. This phase may last up to 10 to 12 years. This phase varies greatly in individuals. It may last up to 10 to 12 years in which the patient is asymptomatic, or it can be as short as a few months. On average, it's around 2 years. But there are people who are in the latent phase, especially if they have access to the latest antiviral medications that can keep the virus in check. So the phase may last up to 10, 12 years, could be as short as a few months. It's averaging around 2 years. This virus can survive for years in the infected cells. And during this phase, there may be times where there's bursts of viral production and further destruction of the T helper cell population. Okay, so during this time, even though the person may be asymptomatic, their virus is continually replicating and destroying their immune system. So I guess we could say HIV is a viral time bomb. Then, the onset of AIDS itself. Step 4 would be the onset of AIDS itself. This is an advanced stage of the HIV infection. So we have the initial phase, the second phase where they are having symptoms, the latent phase, which can last quite a long time, and then fourthly, we have the onset of AIDS, or the advanced stages of HIV infection. Okay, so the onset, what happens is the accumulated virus overwhelms the immune system. And then as the immune system deteriorates, they get their initial symptoms all over again. They go back to the fever, headache, enlarged lymph nodes, general fatigue, severe weight loss, skin rashes. And these can occur in intermittent bouts as the virus replicates, causes symptoms, etc. So that's the advanced stages of an HIV infection. Then final stage. Final stage is referred to, so number 5, the final stage is referred to as full-blown AIDS. This is when, what I mentioned earlier, those opportunistic infections and cancers attack the body, which can no longer fight them off. That's full-blown AIDS. This is when the person experiences very severe infections and cancers that they have no immune system for. These opportunistic infections and cancers are known as AIDS-related illness. They're separate. There are different organisms involved, different problems involved. The problem is that there's no immune system. So other infections will kill the person. Other cancers will kill the person. This is full-blown AIDS, and these diseases are called AIDS-related illnesses. There are a couple I want to point out. All of them are odd infections and rare cancers that ultimately will kill the AIDS patient if they're not already dead from the chronic fatigue and severe weight loss. Okay? Some infections. These are infections that were identified in those homosexual males back in the early 80s, and it was very confusing. Where did these come from? What's causing it? And the first one is called MAC, M-A-C. This is a very severe fungal infection of the lungs that nobody gets that has an intact immune system. The MAC, the MAC, stands for Mycobacterium avium complex. Very severe fungal infection of the lungs. They also get a rare pneumonia called PCP, pneumocystis carnii pneumonia, a very odd pneumonia, PCP pneumonia, another very odd organism causing a pneumonia, which people with an intact immune system do not get. Then, of course, many of the cancers that have viral basis will take over in an AIDS patient. The famous cancer that was helped identify the disease is called Kaposi sarcoma. Kaposi, capital K-A-P-O-S-I. So that's a physician's name that identified it. Kaposi's sarcoma. That's an example of a cancer that only people who have no immune system will contract. So that is called full-blown AIDS, and a person is going to die of an AIDS-related illness. There's also an AIDS-related dementia that can happen to AIDS patients. AIDS-related dementia. And this is a problem because the macrophage actually spreads virus into the brain. And so the person becomes, they're going to get dementia. They're going to lose their neurological functions. Okay, so that is the AIDS virus and the progression of the viral infection. The next thing I want to just mention, I've kind of mentioned it a little as we go, but I'm going to give you a history of AIDS in the United States. A brief history of AIDS in the United States. This goes back to around 1979, 1981 in particular. Rare cancers. So during the late 70s, very early 80s, rare cancers, in particular that Kaposi's sarcoma and pneumonia cases, the PCP, very odd organism to be causing pneumonia, were recognized by the CDC in San Francisco, Los Angeles, and New York City among homosexual men, and these were not found in normal individuals with healthy immune systems. So the first thing that was noticed about this infection is it's destroying the immune system. Something is destroying the immune system. 1982, the term AIDS was first used to describe the occurrence of these opportunistic diseases. Acquired immunodeficiency syndrome, named in 1982. By 1983, the virus was isolated that was known to cause AIDS. The virus was isolated and named HIV, human immunodeficiency virus. 1997, yes?
You said the virus was isolated, what does the isolation mean? Was it removed?
What they were able to do is actually detect a new virus that they didn't know, they didn't recognize in the blood of AIDS patients. So they discovered it, realized it was a brand new virus, and gave the name to it. That was 1983. 1997, one of the last years that you can get statistics for. How many of you have been to the doctor and had to sign a so-called HIPAA paper? You're all over 18, right? And you have to sign that you can't release your medical information and so on and so forth. It's very difficult to get accurate statistics on things like abortion and things like AIDS because of all the privacy laws in the United States. So I can't give you any recent statistics because I can't get any that I would even think would be accurate. But in the United States in 1997, prior to all the HIPAA laws and privacy laws of the 2000s, there were around 612,000 AIDS cases. This does not include HIV positive. These are people that are already to stage 4. They have AIDS. And there were, according to the CDC, that's the Centers for Disease Control in the United States, one of the government agencies. So if you hear me refer to CDC, that's the government agency involved in tracking diseases and so forth. The CDC registered 379,000 deaths from AIDS-related diseases since 1981. So we're talking 81 to 97. Not in a year, that's total AIDS deaths, according to the CDC. And so at that point then, the CDC listed AIDS as the number 14 cause of death in the United States overall. The second cause of death, number 2 cause of death in the United States in 25 to 44-year-olds. So we're getting to the point where we were having a real problem with AIDS in the 1990s, early 2000s. And like I said, the statistics are difficult to come by, but you can't hide the fact of who gets the disease and how it's spread. That doesn't change anything. Who gets the disease and how it's spread. So who gets the disease? Homosexuals, illegal drug users. Okay, that's whole entire, let's call it subculture. We won't call it community. How is it spread? Sexually transmitted, needle sharing. So we can't hide the fact, even though, it's not politically correct to talk about AIDS and to release statistics, even though AIDS is very dangerous, okay? So the next thing I want to talk about is what's called the epidemiology of AIDS. How about that for a term? Epidemiology, that's the same root word as the word epidemic. Epidemiology, E-P-I-D-E-M-I-O-L-O-G-Y, epidemiology. Same root word as the word epidemic. This is defined as the patterns displayed by a disease. How does it spread? Who contracts it, etc. It's called epidemiology. So, first thing I want to talk about is occurrence of AIDS, the occurrence of AIDS. A little more specific than what I was just mentioning. First of all, in the United States, what is the occurrence of the disease in the United States? As I mentioned before, in the United States, almost exclusively, this disease is caught and carried by what we refer to as at-risk groups. Okay, that's the polite way to say it, at-risk groups. So in the United States, there's very, very little accidental transmission of the AIDS virus, especially now that the medical profession has taken steps to protect itself by making sure that all kinds of things, splash shields, face masks, hoods, in your very invasive surgical procedures, they're actually wearing a contamination suit. Okay? I have some experience with orthopedic surgery, which can be very invasive, high potential for blood splatter, and they are wearing full contamination gear. Suit, gloves, helmet, and so forth, just to protect themselves from unknown infections. Because it is illegal in the United States for people to talk about, oh, this person is HIV positive, we need to be careful with their blood, so they have to be careful with everyone's blood, which is probably a good idea anyways. So there is very little accidental spread of AIDS in the United States. It is a blood-borne illness, and you can contract it from blood-to-blood contact, accidental blood-to-blood contact, like a splash, because remember, the mucosa is not impervious to viruses. Only intact skin is. So the medical profession is very careful with human blood. So in the United States, transmission of the virus is almost exclusively at these so-called at-risk groups. That includes, first and foremost, homosexually active men. Number 2, illicit drug users through the sharing of needles. All right, this is a disease that Exodus 15:26 is talking about, okay? We don't have to worry about getting AIDS, even though we may have to deal with it. Number 3, the partners of anyone in the 2 above groups. Fourth group is infants. That one is probably the worst. You have innocent newborns that are HIV positive because their mother was HIV positive. Okay, and then the fifth category really is no longer in effect, and that's recipients of blood transfusions. A very famous case years and years ago was Ryan White, actually in the state of Indiana. He was HIV positive because he was a hemophiliac. He had to have regular blood transfusions because his blood didn't clot very well. He's a hemophiliac, okay? And he got AIDS through a blood transfusion. That was a long time ago. I think it was in the 80s. And the blood supply is much safer now. It is screened for HIV and hepatitis and other things. So the United States, again, we can't ignore the fact that only people in these groups get AIDS. Yes? The partners of anyone in the above two groups. So again, you're talking about people who are promiscuous, both men and women. Okay. Secondly, the occurrence in Africa, the Caribbean, and Latin America is entirely different than the occurrence in the United States. It's different. Everything that I'm talking about is referring to us in the United States, not to other parts of the world. So in Africa, even parts of the Caribbean and Latin America, first of all, it's epidemic in parts of these areas. Number two, it involves men and women almost equally. It's not the same as it is in the United States at all. And a third idea with Africa and so forth is that you have many infants that are born HIV positive. So it is a different case in other countries. That's the occurrence. Next, the transmission. How is the AIDS virus transmitted? Transmission of the virus. First thing to understand is that HIV, the virus, is present in the blood and body fluids of infected individuals. It is a blood-borne pathogen. It is present in the blood of HIV-positive individuals, whether or not they are symptomatic. Doesn't matter. It's present in their blood. Okay, so second point under transmission is that HIV is a blood-borne pathogen because it is spread by contact with infected blood. It's called that blood-borne pathogen because it's spread by blood contact. It is not spread by casual or even familiar contact. What do I mean by familiar contact? I mean people in the same family who live together, eat off the same utensils, etc. Okay, so it is a blood-borne pathogen spread by contact with infected blood. Another idea here, that this blood-to-blood contact occurs almost exclusively by sexual contact. It's a sexually transmitted disease, no doubt about it. It is not caused by casual contact, as I said. You're not going to get it from a drinking fountain. You're not going to get it from a toilet seat. You're not going to get it from hand-to-hand contact, and not family or familiar contact. You won't get it by eating utensils. You won't get it off of bedding or towels. It does not spread that way. Okay, it is a sexually transmitted disease. It does not spread by casual contact or even contact within the same family. It can occur and does occur through needle punctures. So those are the main two ways. That's why the medical profession is very careful with needles. Everywhere you go, there's those little red boxes, the sharps containers. And immediately, procedure is to break the thing, in the sharps it goes. You don't see needles laying around. It's very much against procedure. Okay? So then the third point about transmission. Mechanical barriers. Healthy, intact skin will bar entry to the AIDS virus. AIDS cannot penetrate intact skin. However, the mucosa allows the HIV virus to penetrate. So that means you have to be careful of the linings of your eyes, nose, and mouth. Just like I said, why people are wearing masks and splash shields. So, in summary, in the United States, HIV was transmitted by homosexual contact initially and primarily. That's the origin of AIDS in the United States. Even though that's not popular to say, that is the truth. Last point about transmission, AIDS can be transmitted accidentally. It can be. There are cases of accidental AIDS transmission. First one is healthcare provider accidental needle stick. Yes, this can happen, but it's very rare, more and more. As I said, the medical profession has taken major steps to protect itself from the spread of certain diseases. Another way it can be transmitted accidentally is a healthcare worker accidentally in contact with infected blood. Yes. But again, the medical profession has protocol from your paramedics all the way through to surgeons. Blood transfusions are really no longer a risk for HIV. Blood has been very carefully screened since 1985, and it is screened for HIV contamination every time. Another question is, can you get HIV from saliva? The answer is, it's been detected in saliva, but saliva contains digestive enzymes, so the AIDS virus does not survive. And there is no evidence that AIDS has ever spread through contact with saliva. Another question is sweat. Again, sweat is on the surface of the skin, and sweat has never been documented to have caused an HIV infection, even during participation in sports. The last question is, what about mosquitoes and other insects? And actually, it has not really been transmitted that way, even in high infection rate areas such as Africa. And this is because the blood-sucking insects are sucking blood out. They're not injecting any blood in. So, and a lot of times too, these diseases are spread by very specific organisms. So we really don't have a problem with that either. Okay. So that's an overview of AIDS. Let me just summarize. Pathogenicity of the AIDS virus. What happens? We've talked about it when we talked about the progression. The first mode of remember we said modes of pathogenicity are deprivation of nutrients and other needed substances, destruction of cells. What does the AIDS virus do? Of those modes of pathogenicity that we've talked about, the main thing that AIDS does is it destroys the T helper cell population, as we've mentioned. Okay. The second mode of pathogenicity is the fact that it can be carried by both the T helper cell and the macrophage. This allows it to escape the immune system, and it also allows it to spread to other areas of the body. Because the macrophage is a virus reservoir. That can't be good, can it? Treatment. There are antivirals that are specific to AIDS to try to prevent the virus replication. A lot of them are very toxic, and all they do is slow the onset of AIDS. So AIDS cannot be cured. The treatment is limited to slowing down the replication of the virus and delaying symptoms. Okay, so it cannot be cured. All we can do is delay it. There's a couple antivirals on the market. That's always changing. But so in conclusion, Is AIDS God's plague on the individual? Couple of reasons. The virus itself. Remember how it's able to hide in the immune system? Remember how it's even harbored by the macrophage? Remember how it mutates because it's a retrovirus? That's important. The virus itself, it mutates because it's a retrovirus. It's harbored by the macrophage. It can hide from the immune system. And then the severity of the AIDS-related diseases. AIDS will kill you. What about its mode of transmission? Okay, that's an indicator. Okay, who has it? So remember, what does Romans 1:27 say? They're going to receive where? In themselves recompense. Then Leviticus talks about homosexuality defiling the land and the penalty for it. Leviticus 18 and also Leviticus 20. Okay, test next class period.